Hello everyone, it's Dr. Fisher. Today we are talking about dry eyes, and one of the things I want to educate you about is the technology that I have in order to diagnose dry eye. So what a lot of people don't realize is that when your eyes get dry, they actually tear. So I have a lot of patients coming to me who say, I don't have dry eyes, they water all the time. Well, the reason why they water is because the eyes are dry, and that's a natural reaction for your body is to produce these tears, but unfortunately they're not really lubricating types of tears, and they have a lot of inflammation in them, and that causes more dryness and more irritation. So you get in this really bad cycle of your eyes are dry, then they get irritated, which causes inflammation, and that inflammation then causes more distortion of the quality of the tears, and then that leads to more dryness, and so you're in this really bad cycle. So when you go to the eye doctor and they give you artificial tears, if that's all that you're using and you still don't have relief, then there could be other things going on. And that's what the tear check does. So the tear check checks 9 different things of your tears and your eyes to see what type of dry eye that you have so that I can treat it appropriately. One of the most common misconceptions is that it's only tear related as far as the water is concerned. But your tears are made up of 3 different layers. There's a mucus layer that allows your tears to attach to the cornea. Then you have the water layer, which could be deficient, but not necessarily. But if it is, then we tell your body to produce more tears. And then there's an oil layer. And what we've learned over the last few years is that this oil layer is extremely important in the process of keeping the eyes moisturized. So the oil glands that make up those oils for your tears are called meibomian glands, and they're located in the eyelash area. And what we do is we scan those. We do something called a meibography, which gives me an infrared scanning of the quality of those glands, and then I can actually show those to you, as well as all of the other factors that we look at when we're diagnosing dry eye. So one of the ways that we treat dry eye is with the OptiLight, the IPL laser that we've talked about before. And that is the only FDA approved IPL for the treatment of dry eye. So we have that here at our facility at Rejuvenate. But we won't necessarily use the IPL unless it's warranted, unless you have meibomian gland dysfunction. If you have dry eye from other types of conditions or for other reasons, then I would treat that accordingly. And sometimes it's a mixture. Sometimes there's meibomian gland disorder and a lack of enough tears. And we can just combine technologies at that point in time to treat all of the different aspects of what might be causing your dry eye specifically. Well, I'm excited to educate you more on dry eye as we go on, and I'll show you some of the actual procedures in the future. But I hope this was a very educational video for you, and we look forward to seeing you soon. Have a great day.